Thank you for joining me today for a presentation on measles and its impact on public health. Today we will explore how this communicable disease has shaped our history and how public health systems have evolved to fight it. We will also cover the specific populations affected, the role of nurses in teaching families essential safety interventions in clinical settings, and current treatment options. Let us begin by looking at the history of the disease. Measles has a long history that dates back centuries. A doctor named Rhazes first wrote down what measles looked like in the ninth century. By 1912, the U.S. realized how dangerous the disease was and began tracking cases officially. Before 1963, measles was a normal part of growing up, and almost every child caught it, which sadly resulted in thousands of deaths every year. Everything changed in 1963 when John Enders created the first successful vaccine. Because of high vaccination rates, the U.S. officially declared measles eliminated from the country in the year 2000, though it still returns through international travel. The impact of measles changed the way countries managed public health across the globe. First, global health organizations created massive immunization programs to distribute vaccines to children in developing countries. Second, governments implemented strict laws requiring children to be vaccinated before enrolling in school to prevent classroom outbreaks. Third, we now have international tracking networks at airports and borders to monitor the movement of infectious diseases. Finally, the rise of internet misinformation has forced public health departments to dedicate significant time and resources to addressing vaccine hesitancy and sharing accurate safety data. Measles does not affect everyone equally, and we must focus on three specific vulnerable populations. Infants under 12 months are at the highest risk because their immune systems are developing and they're too young to receive the vaccine. School-aged children and adults who never received their shots form the second group, as they can easily catch and spread the virus through communities. The third population includes individuals with weakened immune systems, such as cancer patients undergoing chemotherapy. These individuals cannot receive live vaccines and rely entirely on the people around them being vaccinated to stay safe. As nurses, patient education is one of our most powerful tools to stop the spread of measles. We must teach families that the vaccine requires a two-dose schedule, with the first shot given between 12 and 15 months of age and the second before entering kindergarten. We need to explain that measles is highly contagious and spreads through airborne droplets when an infected person coughs or sneezes. Families must learn to spot the early symptoms, which include a high fever, a cough, runny nose, red eyes, and tiny white spots inside the mouth. Finally, if a child does get sick, parents must isolate them at home for at least 4 days after the rash appears to protect the public. When a patient presents with suspected measles, immediate nursing interventions are required to maintain hospital safety. First, the patient must be placed immediately into a negative air pressure isolation room to keep the airborne virus from escaping into the hallways. Second, any healthcare worker entering the room must wear a properly fitted N95 respirator mask. Third, the nursing staff must review medical records and identify every single person, including staff and visitors, who may have come into contact with the patient. Fourth, we must notify the local public health department immediately so they can begin tracking community exposures. While there is no specific antiviral cure for measles, we use four main strategies to treat patients and prevent the disease after an exposure. For infected children, doctors prescribe high doses of vitamin A, which is proven to prevent severe complications like blindness and lower the risk of death. For unvaccinated individuals who are recently exposed, giving them the measles vaccine within 3 days of exposure can stop the disease from developing entirely. High-risk individuals, like pregnant women or infants, can receive a special immune globulin injection within 6 days of exposure to give them temporary protection. We provide supportive care, including fluids to prevent dehydration and acetaminophen to reduce fevers and improve comfort. Additionally, lukewarm baths with mineral salts and/or oatmeal can reduce fever and body aches, as well as ease the itchiness of the skin. This presentation was built upon reliable data from major public health authorities and medical journals. The historical milestones and tracking data came directly from the Centers for Disease Control and Prevention. The current data regarding global outbreaks, modern vaccination challenges, and vulnerable populations are based on recent research published in the Lancet Medical Journal. These sources highlight that while measles was once eliminated, continuous education and high vaccination rates remain necessary to keep communities safe. Thank you for your time.